Hey everyone, and welcome back for another deep dive. Today we are talking about healthcare in Gujarat.
Oh, yeah.
It's a state that is really known for being like a powerhouse
Yeah.
when it comes to the economy in India.
Yeah.
But when we look at the health outcomes,
Hmm.
it's a little bit of a different story.
Interesting.
Things like infant mortality, malnutrition,
Right.
even vaccination rates,
Yeah.
they're really just kind of average
Right.
if you compare them to the rest of India.
It is a bit of a head scratcher, isn't it?
It is.
You would think
Well,
with such a strong economy
Exactly.
that the healthcare system would be,
Yeah. Flourishing.
really top notch.
Yeah.
But that doesn't seem to be the case.
So that's what we're trying to figure out today.
Yeah.
We've got a ton of reports and articles and even like
Budget stuff.
budget breakdowns,
Mhm.
all to kind of dig into.
I'm ready.
And what we're really going to try to unpack is what role the Gujarat government is playing in all of this. And then also what challenges they're facing.
Well, the government has made it very clear that they believe that a healthy Gujarat equals a
Right.
prosperous Gujarat.
Of course.
And they are putting resources towards healthcare infrastructure.
Okay.
So they've got a whole network of these primary health centers
Yeah.
or PHCs. They're kind of like your first
stop.
your first point of contact.
Right.
And then you've got the community health centers for when things are a bit more serious.
Okay.
And then, of course, the larger institutions for the really complex cases.
So like the UN Meta Institute
Like the
of
Swiss
Cardiology
Institute.
and stuff like that?
Yep. And the Gujarat Cancer Research Institute.
Okay.
Some of the big names that you might recognize.
Yeah.
And many of these offer care either for very low cost or completely free.
Which is
really important, especially when you consider the folks in rural areas
Right.
where they may not have other options. The government really is the main provider for them.
Okay, so that covers kind of the basic
Right.
healthcare needs.
Yeah.
But what about the people who need
More specialized.
the specialized stuff?
Yeah.
Where does that
Where does that come in?
fit in?
Well, that's where some of these big projects come in.
Okay.
Like there's a brand new All India Institute of Medical Sciences,
Oh, wow.
or AIIMS as it's known.
Right.
And it's being built in Rajkot,
Uh-huh.
and it's going to have 750 beds.
Wow.
So it's
That's huge.
quite a statement.
Yeah.
It's still under construction,
Mhm.
but the government is really banking on this to kind of revolutionize specialized care.
So it sounds like they're really putting their money
Yeah,
where their mouth is in terms of
exactly.
infrastructure.
Yeah, they are. And in fact, just recently,
Okay.
in the budget, they've allocated a 16% increase for healthcare spending.
Oh, wow.
So
That's a lot.
that includes things like these Medicity level upgrades for civil hospitals and 4 new cancer institutes.
That's pretty ambitious.
It is.
But it's like we were talking about.
Yeah.
Infrastructure is just one piece of this whole puzzle.
Right. Yeah.
We need to make sure people can actually access
Right.
these services.
Absolutely.
So, like, it doesn't really matter if we have this shiny new hospital if people can't afford to get there.
Right.
Okay.
Or if there aren't enough doctors to actually treat them.
Exactly.
You're absolutely right. And that's where things get
Yeah.
a little bit more complicated.
Okay.
Gujarat has actually been kind of a pioneer
Mm-hmm.
when it comes to these public-private partnerships,
Okay.
or PPPs as they call them.
Got it.
And they've been using schemes like the Mukhyamantri Amrutam Yojana,
Wow.
which is a health insurance program,
Okay.
to basically involve private hospitals in providing care.
So the government's kind of footing the bill and the private hospitals are
Right.
providing the care.
Exactly. They're trying to
Okay.
take advantage
There's
of.
best of both worlds.
Yeah. Get that extra capacity
Yeah.
without having to rely solely on the public sector.
Right.
Trying to combine the strengths of each.
Yeah.
Of course, anytime you bring in multiple players,
Mm-hmm.
you're going to have challenges.
Yeah, I can imagine.
Yeah,
We'll definitely have to dig into those a bit later.
we will.
But before we go there,
Yeah,
we can't forget about the National Healthcare Program.
that's right.
Right.
Things like Ayushman Bharat
Yeah.
and the National Health Mission,
Uh-huh.
these are nationwide, but
Yeah.
each state implements them
In their own way.
a little bit differently.
So what's the Gujarat flavor?
Yeah.
How are they actually being implemented?
Well, you see things like health fairs popping up in villages,
Okay.
trying to reach people where they are.
Right.
You've got the One Gujarat, One dialysis program,
Okay.
which has led to tons of dialysis centers opening up across the state.
Mm-hmm.
So it's really all about how effectively
Yeah.
they can adapt these nationwide programs
Right.
to the specific needs
Of the people of
of
Gujarat.
their people. Exactly.
So it seems like the government is really taking this multi-pronged approach.
Multi-pronged approach.
Yeah.
Absolutely.
Building new stuff.
Yep.
working with the private hospitals, implementing these national programs.
Yeah.
But the question is it working?
Right.
Are we actually seeing...
Yeah. Is it translating into better health?
For the people.
For the people of Gujarat.
Yeah.
That is the million-dollar question. And I think
yeah.
it's a question with a very complex answer. Because there are some significant hurdles that we need to look at.
Right.
That the government is facing in this quest towards a truly healthy Gujarat.
Okay, so let's get into it.
Let's do it.
Okay, so we've laid out kind of the game plan the government's putting in place to try to improve healthcare. But you mentioned there's some hurdles.
There are.
What are they?
Well, one of the biggest ones, and it's kind of the elephant in the room, is funding.
Okay.
Historically, healthcare spending in Gujarat has been below 1% of the gross state domestic product.
That doesn't sound like a lot.
It's not.
Yeah.
Especially when you consider the World Health Organization recommends at least 3% or more.
Okay.
And while they have made that increase in the recent budget to 16%,
right,
some critics are saying it's still not going to be enough to address all of the gaps.
So even with the increase, it might?
It might be
too little too late.
Yeah, it's a valid concern.
Okay.
But it's not just about the amount.
Right.
It's also about how that money is used.
Right. Throwing money at a problem doesn't necessarily solve it.
Exactly.
Yeah.
You need a good plan for how to allocate those resources.
Right.
And that brings us to the next hurdle.
Okay.
Which is staffing shortages.
Okay.
We can build all the hospitals we want.
Right.
But if we don't have the doctors and the nurses to staff them,
it's not going to do much good.
Exactly.
Yeah.
It's like having a state-of-the-art kitchen. But no chef.
Yeah, all that potential just sitting there.
Gonna waste.
Unused. Yeah.
Exactly. And this shortage is really bad.
Okay.
Particularly in rural areas. It's just really hard to attract doctors.
Yeah.
To go work in government facilities out there.
Yeah, I mean, low pay.
Yeah.
Tough working conditions.
Tough working conditions.
And then you have private practice, which probably seems a lot more appealing.
It does. And the government has tried to address this with this thing called the bonded doctor system.
Okay.
And this basically requires doctors to serve for a certain amount of time.
In rural areas?
In rural areas.
Yeah.
After they finish their training.
Okay.
But even that.
Hasn't really been that effective?
It hasn't been as effective as they'd hoped.
What's going wrong there?
Well, a lot of doctors are just choosing to pay fines.
Instead of...
rather than do that service.
Really?
Yeah, so they're losing talent faster than they can retain it.
So we've got the shortage of doctors overall, and then the ones that we do have aren't going where they're needed most.
Exactly.
What about the ones who are working in the system, though? Yeah. Are they able to actually do their jobs effectively?
That's another great question.
Yeah.
And it brings up this issue of execution and accountability.
Okay.
There was a government audit back in 2018.
Oh.
And they found some pretty concerning stuff.
What'd they find?
Well, they criticized Gujarat for not using their healthcare budgets effectively, leaving crucial positions vacant.
Like
gynecologists.
Oh, wow.
Pediatricians.
Yeah, those are pretty important.
Yeah, essential positions.
Right.
And what was really concerning was they linked these vacancies to preventable deaths.
Really?
Particularly among mothers and children.
It's like, it's not just numbers on a spreadsheet. We're talking about real people.
Real lives.
Real families impacted by this.
Yeah. And then on top of that, you've got the issue of malnutrition.
Malnutrition, yeah.
Which is still a huge problem in Gujarat.
Yeah, I was going to ask you about that because it seems strange that in a state that's doing so well economically, that you would still have such a widespread malnutrition problem.
It's a paradox.
Yeah.
You know, they do have this network of Anganwadi centers, which are supposed to provide nutritional support, especially for women and children.
Yeah.
But despite that, a third of the children in Gujarat are underweight.
Wow.
So it really shows you that economic growth doesn't automatically equal better health.
Right. There's other factors at play.
Right. All these social and systemic factors that we often overlook.
And it's not just a rural versus urban thing.
Right.
I imagine
it's everywhere.
Within the cities, there's still disparities.
Absolutely. You can have a city like Ahmedabad with world-class hospitals and still find pockets where people
have access to
don't have good access to healthcare.
And we've been talking a lot about the government's role, but the private sector plays a pretty big role too, right?
It does.
In Gujarat?
Yeah, you've got hospitals like Apollo and Sterling, which are major players, especially for that specialized care, they've often got cutting-edge technology, and they offer things that the public sector just can't.
Yeah. But I imagine cost is a factor.
Cost is a huge factor.
With private healthcare.
Huge barrier for a lot of families.
Yeah.
Especially because in India, a lot of healthcare spending comes directly out of people's pockets.
Really?
Yeah.
Wow.
So while the government has those PPP programs to try to help with that, enrollment's limited.
Yeah.
And people still face massive out-of-pocket expenses.
So even with some help, it's still
out of reach for a lot of people.
Yeah.
And there's also the issue of regulation.
Okay.
In the private sector.
Right, because there's been a lot of growth.
Yeah, the rapid growth has led to some concerns about quality, ethical practices.
Yeah, I mean, you read those reports about overbilling and...
Yeah, unnecessary procedures, subpar care.
It's a little worrying.
It is. It shows that there needs to be...
some oversight.
Yeah, stricter oversight and regulation.
To make sure that people are protected.
Exactly, and quality is maintained.
So it's kind of this balancing act.
It is.
You want to involve the private sector to expand access.
Right.
But you also have to make sure...
that it's done well.
That it's being done properly.
Responsibly.
Yeah.
And on top of all of that, they're facing the same manpower problems as the government.
Oh, so they're all competing for
the same pool of doctors and nurses.
Which is already small.
Exactly.
Yeah.
Which just makes the problem worse.
It's a vicious cycle.
It is.
And then you factor in like rising real estate costs.
Right.
Electricity, all of that stuff, which gets passed on to the patient.
It all adds up.
Yeah. It's a pretty
complex,
bleak picture.
It is complex. There's no doubt about that.
Yeah.
But I think it's important to understand all of these challenges if we want to find solutions.
Okay, so let's move on to the solutions.
Right.
What can we do to improve healthcare in Gujarat? What can the government do? What can the private sector do? How do we make sure that everyone has access to quality healthcare? So we've definitely uncovered some challenges facing healthcare in Gujarat. Yeah. But I like to stay optimistic. So let's talk solutions.
Let's get to it.
What can we actually do to improve these health indices?
Well, I think for the government, it's about getting back to basics.
Okay.
Really strengthening that foundation. Yeah. We're talking about getting more doctors into those primary health centers, making sure the facilities are well-equipped, and really tackling this malnutrition problem head-on.
It sounds like a big focus on primary care.
Absolutely, primary care is key. Yeah. And vaccinations, too.
Right.
Gujarat's full immunization rate is...
it's behind.
It is lagging behind.
Yeah.
You've got districts like Panchmahal with really low coverage, but then you've got places like Jamnagar that are doing much better.
Okay.
So figuring out what's working there and sharing those best practices could really help.
Okay, so primary care vaccinations for the government?
Yeah.
What about the private sector?
Well, they've got a big opportunity here to really expand access to quality care, but they have to do it responsibly.
So that means?
Keeping costs in check.
Affordability?
Affordability.
Okay.
And transparency.
Transparency.
Absolutely. Like that people know what they're getting.
It's all on the up and up.
Exactly.
Okay.
And technology can play a big role here.
Oh, yeah. How so?
Well, we're seeing all these new telemedicine and healthcare IT solutions.
Yeah.
And both the government and private companies can use these to reach those people in remote areas who might not have easy access otherwise.
So it seems like collaboration is really the key.
Collaboration is key.
Yeah.
You've got to have the government and the private sector working together.
Yeah.
The government sets the stage with funding and policies and infrastructure. The private sector brings their expertise and their scale and their ability to innovate.
So it's not either.
It's not either.
It's both and.
It's both and working together.
Yeah.
And we have to remember, this isn't a sprint. This is a marathon.
Right.
This takes long-term vision, sustained effort, a willingness to learn and adapt.
Such a journey.
It's a journey.
Yeah. So as we wrap up our deep dive into healthcare in Gujarat, it's clear that there's a lot to be done.
There is.
But there's also...
a lot of potential.
A lot of potential, yeah.
Absolutely.
There's ambition, there's innovation.
We've seen it.
There's a desire to make things better. So now the challenge is to turn that into actual results.
Right.
For the people.
Make it happen.
To make sure that everyone in Gujarat has the opportunity to live a long and healthy life.
Absolutely. And as you continue to think about this, here's something to consider. We've talked a lot about doctors.
Yeah.
But what about nurses?
Oh, that's a good point.
They're the backbone of any healthcare system.
They're often overlooked.
They are.
Yeah.
So as we strive for this healthy Gujarat, it's worth thinking about how to strengthen nursing education.
Oh, okay.
Training career pathways.
How do we get more nurses?
How do we attract them?
Yeah.
How do we keep them, especially in those underserved areas?
That's a great question to leave our listeners with.
Yeah.
The role of nurses is crucial.
Absolutely.
Thanks for joining us on this deep dive into healthcare in Gujarat.
My pleasure.
Until next time.